Bismillahir Rahmanir Rahim. Assalamu alaikum everybody. This presentation is completion of what we have started in our last presentation about the general pharmacological action of sympathomimetics. We make a quick revision of what we have said in our last presentation. We classified sympathomimetics into two major classes. One, which act directly on adrenergic receptor, directly acting sympathomimetics, and this we said that they act as an agonist on the receptor. Agonists, that means they have affinity and intrinsic activity. The second are the indirectly acting sympathomimetics, and these they act by the release of noradrenaline, where they uptaken into the nerve terminal and they displace noradrenaline from the storage vesicles, and noradrenaline will do the job. We also talked about the types of adrenergic receptor. We said that they are classified mainly into four main types. The first are the alpha-1 receptor, adrenergic receptor, and we have said that these alpha-1 adrenergic receptors, they are linked to alpha-1 adrenergic receptors, they are linked to GQ protein, and GQ protein stimulation by alpha-1 agonist will lead to stimulation phospholipase C enzyme. Phospholipase C will act on phospholipid, membrane phospholipid, producing two second messenger, DAG and IB3. We have said that DAG and IB3, they have specific action in increasing intracellular calcium. So, alpha-1 agonists, they are always excitatory except in the intestine. Okay? The other type are the alpha-2 receptors, and we said that alpha-2 receptors, they are linked to GI protein, inhibitory G protein, which will inhibit the formation of cyclic AMP, and that's why we said that they are sympatholytics. They are not classified as sympathomimetic. They are sympatholytics. They decrease sympathetic activity. A third type are the beta-1 agonist, beta-1 receptor, and we said that beta-1 receptors, they are linked to GS protein, and stimulation of beta-1 receptor and activation of GS protein will lead to activation of a membrane enzyme adenylyl cyclase, producing the second messenger cyclic AMP. Cyclic AMP on the beta-1 receptors will increase the intracellular calcium through different mechanisms, as we have said before, and usually always the beta-1, they are excitatory in nature, and we spoke about their effect on the heart muscles by increasing conduction, contraction, and rate. The fourth type are the beta-2 receptors, beta-2 adrenergic receptors. Beta-2 adrenergic receptors, like the beta-1, they are linked to GS protein, where their stimulation will lead to the formation of cyclic AMP. They increase cyclic AMP formation. But the action that results from stimulation of beta-2 always inhibitory, like their effect on the smooth muscle, and this inhibition will result from a different specific mechanism of action we'll talk about in a few minutes. Okay, so beta-2 effect we expect, for example, on smooth muscles of the of the lungs, they produce relaxation of the smooth muscles of the lung. So this is a quick revision of what we have taken last lecture. So what's the goal of this lecture? The first goal, we should know the mechanisms by which beta-2 agonist produces relaxation of smooth muscles. We'll talk about it in a few minutes. The second goal is to know what are the general effects of sympathomimetics on smooth muscles of the body, including smooth muscles of the bronchioles, of the uterus, of the eye, of the gastrointestinal tract, and the urinary bladder. Also, we should know about the pharmacological action of sympathomimetics on the metabolism and exocrine glands. So before we start with the effect of sympathomimetics on smooth muscles, we have to know how beta-2 action can produce relaxation of smooth muscle. Just imagine that in the relaxed state, in a smooth muscle in the relaxed state, the actin myofilament and the myosin myofilament, they are apart from each other. Once the myosin is activated through myosin light chain kinase, as we have said in several times in previous presentation, myosin light chain kinase will provide energy to myosin, which is a phosphorus group. This energy will cause sliding of myosin over actin and muscle will contract. Okay, so this is usually the mechanism responsible for muscle contraction. Myosin light chain kinase, we write it down, myosin light chain kinase. This is kinase. This is a kinase enzyme that we will talk about in a few minutes. So myosin light chain kinase will activate myosin, will give it a phosphorus group. Myosin will be phosphorylated. It will slide over actin, shortening the muscle. At the same time, there is another mechanism in the muscle which causes relaxation of the muscle. This mechanism responds to myosin light chain phosphatase. Myosin light chain phosphatase. This enzyme will cause dephosphorylation of the myosin molecule, myofilament. Dephosphorylation means removal of the phosphate group. Once it is dephosphorylated, myosin will be aborted from actin and the muscle will be relaxed. Okay, so this is usually the mechanism of contraction and relaxation. Contraction is provided by the energy given by myosin light chain kinase, and the relaxation is done by removal of energy from myosin by the myosin light chain kinase phosphatase. Myosin light chain phosphatase. So let us take an example of contraction and another example of relaxation. Example of contraction we have already taken before. We explained in details. They are related to muscarinic type 3 receptors, M3 receptors. When they are stimulated, they stimulate GQ protein. GQ protein will stimulate phospholipase C enzyme. Phospholipase C will convert phospholipid, phosphatidylinositol biphosphate, converted into IB3 and DAG, inositol triphosphate, or IB3 and diacylglycerol. IB3, as we have said before several times, it will cause release of calcium of sarcoplasmic reticulum by acting on specific IB3 receptors, opening calcium channel. Once calcium in the cytoplasm it reacts with calmodulin, and this complex, calcium calmodulin complex, will activate myosin light chain kinase. Once myosin light chain kinase is activated, it provides energy to myosin and muscle will contract. Okay? This is one of the mechanisms responsible for muscle contraction. For muscle relaxation, our example is the beta 2 adrenergic receptors. Beta 2 adrenergic receptors, once the agonist binds to the receptor, it will stimulate GS protein, GS will activate adenylyl cyclase, which was known before as adenylate cyclase, but now it is known as adenylyl cyclase. Adenylyl cyclase will convert ATP into second messenger cyclic AMP. This is the second messenger cyclic AMP. Cyclic AMP will activate cytoplasmic enzyme protein kinase A. Protein kinase A will give energy to myosin light chain phosphatase, which will dephosphorylate the phosphorylated myosin. Okay? So, I repeat again, beta 2 agonists, once they bind to the receptor, they stimulate GS protein, which will activate adenylyl cyclase, converting ATP to cyclic AMP. Cyclic AMP in the cytoplasm will activate protein kinase A, will give energy to protein kinase A, which will in turn will activate myosin light chain phosphatase, and this will dephosphorylate. Dephosphorylate means the removal of the phosphate group from the myosin head, and this will result in relaxation of the muscle. So these are how beta 2 agonists, although they increase cyclic AMP, they produce relaxation of the muscle. There is another mechanism in which they said that protein kinase A as well, this protein kinase A activated by cyclic AMP will decrease oscillation of calcium induced by drugs that increase muscle contraction. But this mechanism is not that important in our case. Okay. Now this is very simply how beta 2 agonist induces relaxation of smooth muscles. So now we'll talk about the actions. What will happen to the different actions on smooth muscles of the body? First, we'll talk about the smooth muscles, bronchioles and the uterus. Both of them, bronchioles and the uterus, they are rich in beta 2 receptors. They respond to beta 2 agonists by relaxation. As we have said, beta 2 is always inhibitory. So what will happen? They respond by relaxation. Once the beta 2 receptors they are stimulated in the bronchioles, smooth muscles or the uterus, relaxation will take place. So what will happen in the bronchioles? Bronchioles will be dilated, and this is known as bronchodilation. Of course, this has very important clinical application where it is used in treatment of bronchial asthma and as well bronchial asthma, and as well as we will see inshallah next presentation, and well in chronic obstructive pulmonary diseases. Okay, so bronchioles will be dilated by the action of beta 2 agonist, and it has very important clinical application. On the uterus as well, uterus will be relaxed. Uterus relaxation, because the smooth muscles of the uterus will be relaxed. Uterus relaxation, this has very important clinical application, especially in treatment of what's known as premature labor. This we'll discuss inshallah in details next lecture. So this is the effect on the bronchioles and smooth muscles of the uterus. Beta 2 action will causes relaxation. And this relaxation, it has very important clinical application. The second effect is the effect on the smooth muscles, sympathomimetic and smooth muscles of the eye. We should concentrate on two things: on the iris, smooth muscles of the iris, which is the pupil of the eye, iris, pupil of the eye, and we should concentrate on the ciliary process or ciliary epithelium, and we'll say why. On the iris, as we have said several times before, iris is surrounded by circular muscle, and it has also a radial smooth muscles. Circular muscle, which controlled by cholinergic mechanisms, are radial smooth muscles. Radial smooth muscles. Radial smooth muscles of the iris, they are supplied by alpha-1 receptors, alpha-1 adrenergic receptor. And we have said always that alpha-1 is excitatory everywhere except where? Except in the intestine. So in this case, what will happen? Contraction of the radial smooth muscles. Once the radial smooth muscles are contracted, they pull away the iris. That means they increase the diameter of the iris, and this is known as mydriasis. They increase the diameter of the pupil, and this is known as mydriasis. Okay, so sympathomimetics with alpha-1 agonist activity, they cause contraction of the radial smooth muscles, and this has very important clinical application in inducing mydriasis. This, of course, it is used in ophthalmic examination, as we will say later. Okay, this is first the effect on the pupil size or on the iris. Second, on the ciliary epithelium, we have said previously that ciliary epithelium is responsible for the production of aqueous humor, and we have said that this aqueous humor, there is continuous production and continuous drainage from the anterior chamber, from the anterior chamber. Okay, now this aqueous humor production is increased by beta agonist increase aqueous humor production. Once they increase the aqueous production, they can increase the intraocular pressure, as we have said in the last. If there is a defect in the drainage of the aqueous humor or in the production of the aqueous humor, this will result in an increase in intraocular pressure, we called it glaucoma. And glaucoma is very dangerous, as we have said, because it can lead to blindness. Therefore, beta-2 receptor, especially beta-2 receptors, they increase the production of aqueous humor, and we expect therefore that they will increase the intraocular pressure. That's why beta blockers that are used, as we'll talk about next lecture, inshallah, next presentation. Beta blockers, they produce the opposite. They block the beta receptors in the ciliary epithelium, and they decrease the production of aqueous humor, and therefore they decrease the intraocular pressure. Alpha-2, which is always, as we said, they are sympatholytics. Naturally, they are inhibitory, so they decrease the production of aqueous humor, and they will decrease the intraocular pressure. Okay, and there are some clinical application of alpha-2 agonists like clonidine. We'll talk about them later, inshallah. Okay, so this is the effect on the eye. Smooth muscles of the iris radial smooth muscles will be contracted due to alpha-1 effect, and this will lead to mydriasis, which has a very important clinical use. And on the ciliary epithelium or ciliary process, the production of aqueous humor is increased by beta agonist, and it is decreased by alpha-2 agonist. Okay, so these are the effects on the eye. Second effect will be the effect on the smooth muscles of the gastrointestinal tract, or especially the intestine. In the intestine, usually there are the sphincters and the smooth muscle themselves. All sphincters, they are contracted. They are contracted due to alpha-1 effect. Therefore, alpha-1 agonist, any sympathomimetic of alpha-1 agonist, they will contract smooth muscles of the sphincters throughout the G.I.T, causing closure of these sphincters. On the smooth muscles, all of them, they are relaxed. And the smooth muscles of the sympathomimetics, all of them, they cause relaxation of smooth muscles of the intestine. This relaxation will result in inhibition of peristalsis, inhibition of peristaltic activity, inhibition of peristalsis. These both effects, اللي هو contraction of the sphincter and inhibition of peristalsis, they produce constipation. They will decrease the intestinal motility, and by closure of the sphincters, like anal sphincter, constipation will ensure. This is, of course, it is a side effect, and it has no clinical application. Okay. Now, this inhibition of peristalsis, they thought that it is either due to beta-2 action, but also they have said that the alpha-1 effect will increase the intracellular calcium by the mechanism we have described, and this increase in intracellular calcium will activate calcium-dependent potassium channel, calcium-dependent potassium channels, causing opening of potassium channel, opening of potassium channels on the walls of the smooth muscle, hyperpolarization of the membrane, and hyperpolarization means inhibition. So this has been suggested as one of the other mechanisms due to stimulation of alpha-1. Therefore, alpha-1, by increasing the intracellular calcium, will activate on the cell wall of the smooth muscle calcium-dependent potassium channel. Potassium channel will open, potassium will rush out of the cell. When it rushes out of the cell, it causes hyperpolarization or inhibition. So this is suggested as one of the mechanisms responsible for the relaxation of the gastrointestinal tract. However, this, as we have said, this effect has no clinical application. It is mainly a side effect. Okay, so the fifth effect will be the effect on the smooth muscles of the urinary bladder, and the urinary bladder exactly like an intestine, where trigon muscle, which is the sphincter of the urinary bladder, is contracted, while the detrosal muscle, which is the smooth muscle surrounding the urinary bladder, is relaxed. Of course, this will result in urinary retention. Both affect the alpha-1. Trigon muscle is contracted by alpha-1 agonist, while the detrosal muscle is relaxed by beta-2 agonist. So therefore, alpha-1 effect on the trigon muscle will contract the trigon muscle, while beta-2 effect on the detrosal muscle will relax the detrosal muscle, and this will result in urinary retention. This as well, it has no clinical application, and it is mainly a side effect, and on this mechanism depends on the use of some antagonists of these receptors in certain clinical application, as we will see later. Okay, so these are the major effects on smooth muscles of the body, of the bronchioles, of the uterus, on the eye, on the smooth muscle of the intestine, and smooth muscle of the bladder, urinary bladder. So lastly, we'll talk about their effect on metabolism. And as we have said before, sympathomimetics are used in fight and fright, and we expect therefore that their effect is to enhance metabolism towards providing the body with energy. How they do that? By different effects on different organs in the body, like in the liver. What they do in the liver, they stimulate glycogenolysis, which is the breakdown which is the breakdown of glycogen into glucose, and glucose will be utilized in energy. This is an alpha 1 effect. Therefore, sympathomimetics, they will increase the production of glucose from the liver by stimulating glycogenolysis, which is an alpha 1 effect. Also, they will affect the pancreas, the endocrine gland, pancreas, producing more insulin, increasing insulin production, of course, because it is fight or fright. So the body will need energy, so it will increase the insulin production, and this is usually a beta 2 effect. Okay, the other organ, the kidney, they will increase the production of renin. Renin is the hormone which is responsible for production of angiotensin 2. We'll talk about angiotensin several times, inshallah, in the near future. Angiotensin 2 is very powerful vasoconstrictor, and as well it increases production of aldosterone, which increases the blood volume through retention of sodium and water. Okay, this is a beta 1 effect. Beta 1. So stimulation beta 1 in the kidney will increase the renin release. Renin will lead to formation of a local hormone known as angiotensin 2, AG2. It's abbreviated as AG2, angiotensin 2. Angiotensin will cause local vasoconstriction, وكذلك it helps in the production of aldosterone, which will increase the blood volume. We expect therefore that if we block beta 1 receptors, will prevent the formation of angiotensin 2, and therefore will decrease the vasoconstriction effect. Okay. Lastly, on the adipose tissue, of course, we expect that sympathomimetics, they increase lipolysis, which is the breakdown of lipid into free fatty acid. Why? Because this free fatty acid will be utilized for production of energy, and this is usually shared by all beta receptors, beta 1, beta 2, and beta 3. All these beta 1, beta 2, and beta 1, beta 2, and beta 3, they stimulate lipolysis in adipose tissue. So these are generally the general pharmacological action of sympathomimetics. We can summarize what we have said, that alpha 1 effect on smooth muscles, all is excitatory except in the intestine. We have explained why. While the beta 2 effect produces relaxation of all smooth muscles of the body, including bronchioles, the uterus, and the intestine. We spoke about sympathomimetics will favor the production of energy through glycogenolysis, alpha 1 effect, lipolysis, beta 1 and 3, 2 and 3 effect, and increased insulin secretion, which is a beta 2 effect. So these are all the general pharmacological action of sympathomimetics. In our next lecture, inshallah, we will talk about the pharmacological action of and clinical application of the individual sympathomimetics. Okay? Till that time, I hope that you will stay in good health and prosperity. Keep well. Wassalamu alaikum wa rahmatullah wa barakatuh. I would like to thank you very much for your attention. If you like my presentation, don't forget to press like, and don't forget please to share with friends. Please subscribe to my channel. Wish you all the best luck. Wassalamu alaikum wa rahmatullah.